Well, hi, everyone. I'm Michael Morella, Managing Editor of Events at US News and World Report. Thanks for being with us today. We're going to be exploring doing business and doing good, the topic of how businesses, corporations, and foundations can impact community health and vitality. You can learn more about our speakers and previous events at usnews.com/events. I also encourage you to check out our site for recap articles and videos of past programs. We are recording video of today's program and we'll be archiving it there as well. Before we get to our panel, a quick note about questions. Audience members, if you have them, we ask that you please type your questions into the Q&A feature in Zoom on your screen. From there, our team will review and try to give voice to some of them over the course of the time. Now I'm pleased to welcome our panel. With us today, I'm very happy to have Daryl Brewster, Chief Executive Officer of CECP, that's Chief Executives for Corporate Purpose. Eileen Howard-Boone, Senior Vice President of Corporate Social Responsibility and Philanthropy and Chief Sustainability Officer for CVS Health. She's also President of the CVS Health and Aetna Foundations. And Latha Reddy, Senior Vice President of Inclusive Solutions at Prudential Financial and Chair of the Prudential Foundation. Thank you all for being with us. Leading the discussion is US News Executive Editor of News and Events, Morgan Felchner. Take it away, Morgan.
Thanks, Michael. And thank you, Daryl, Eileen, and Latha for being with us today. While it's always important for businesses to do more than make a profit, the last year and a half has really illustrated that. From the racial justice protests of last summer to the ongoing coronavirus pandemic, it's clear that businesses are leading the way on improving society and specifically community health. So let's dive into that today. Let's start by learning a bit more about each of you. Eileen, can you tell us about your roles at CVS Health and the CVS Health and Aetna Foundations? Could you talk through maybe a few of the major initiatives that you're working on? And actually, before you start, I should note that US News partners with the Aetna Foundation and CVS Health for our Healthiest Communities project, an ongoing journalistic project and an annual ranking of counties across the United States based on metrics tied to the social determinants of health. We released our latest rankings in late June, and I encourage you to explore all the related content at usnews.com/healthiestcommunities. Now, Eileen.
Sure, thanks, Morgan. And as Morgan noted, that US News and World Report Healthiest Communities is a really great content site. So I encourage everybody to reach out to take a look at their own community and compare and contrast as they go forward. So I'll start by saying I'm the Senior Vice President of Corporate Social Responsibility and Philanthropy at CVS Health. I've been there for well over 17 years. And over the course of my career, we have done a number of very important things. And I would say from a corporate social responsibility perspective, you can see us as advisors and counselors on what's going on in the E, the S, and the G of our company, spending a lot of time on responsible business practices, things that we need to think about from a broader term perspective and planning, in addition to the community investments. And as you noted, I'm the president of both the CVS Health and the Aetna Foundations, and we make significant investments in community health all across the country. We fund in 48 or 49, depending on the states, across the country. We have over 300,000 colleagues, so also including them in the process of community activation and from a colleague engagement standpoint. So I'm very happy to be here. We have a variety of different programs that we could probably get into as the challenge of what we've been facing with COVID. We've done a lot of things across our company, both from a commercial perspective, as well as through the philanthropic perspective. I'm happy to jump in with you all and kind of really just chat about this.
Thank you. Latha, you too hold several roles and responsibilities with Prudential and its foundation. Can you tell us a bit about that, particularly the insertion of inclusivity in strategic investments?
Sure. Thanks, Morgan, and thanks for having me here and be part of this conversation. So I lead an organization called Inclusive Solutions. And well, first I've been with Prudential for, I guess about 10 years now. I was with the company, I left and I came back. And so since I've been back, we've been on a bit of a transformative journey with our work. And I'll kind of talk about where we are now, where we've come to, and then as we get into the discussion, kind of where we're going. But you know, my role is really, it's not so dissimilar, I think, from Eileen's, we're kind of the tip of the spear of purpose. And so it's to help ensure, in working with my colleagues across the company, that our day-to-day business activities and other activities are rooted in our purpose and in our values. And so for us, for financial services, our purpose is around making lives better and solving the financial challenges of our changing world. And so we leverage the resources that my team actively manages. So our philanthropy, impact investing, employee engagement, so the time and talent of our employees and executives, and other capabilities that we have with the core capabilities of our business. And so, that means that we're able to create a virtuous cycle, if you will, of engaging in societal issues, right? Trying to create societal impact, open pathways for business opportunities so that we can take that impact to scale in a different way, really, and go to market inclusively. And so that's where the inclusion part comes, that we are centering inclusion and racial equity in all of our work, because one of the greatest financial challenges of our time is the racial wealth gap. And so we are squarely focused on helping the company address that.
Daryl, let's widen our lens a bit from a specific company or foundation. Can you first tell us about CECP and your work, and who are your members, what is the scale, and what do you offer?
Thank you, Morgan. And it's really a pleasure to be on this panel with Lata and with Eileen. At CECP, which has been around now for 22 years, we have an annual award for the individual who really contributes the most to the field of business. We call it the Charlie H. Moore Award, named after my predecessor, and a 1952 gold medal Olympic medalist in the high hurdles. So as we've all watched the Olympics over the last few days, and both Lata and Eileen are Charlie Award winners. So it's really a pleasure to be on the panel and the great work that's done at Prudential and with CVS Aetna. So delighted to be here. As I mentioned, CCP was founded back last century in the late 90s by CEOs and Paul Newman, the actor / salad dressing maker, for CEOs and their teams like Lata and Eileen, with the belief that the world's leading companies can and should be a force for good in society. The making money is fine, but how you do it really matters, and the impact of what you do with that can really make a difference to build a better world. So really delighted to be able to work with companies. We work with more than 200 of the world's leading companies. You put the revenues together, it's about a little north of $7 trillion US. We like to say it would be the third largest economic unit in the world, after the full United States and after China. Now, our companies don't always work together, although they're increasingly doing that, but neither do the states, we find these days here in the US. So those are some of the challenges that we really work with to really help companies, to support them on their purpose journeys. And we're really delighted to work with them. We also have global exchange partners throughout the world, and I think more than 150 other nonprofit partners that we work with, but all in this notion of helping advance and support companies on their purpose journeys.
Thank you all for being here. I think we're going to have a terrific discussion today with lots of great insights from everybody. So let's start by unpacking the biggest question. What can businesses do to make the world better? And what role should they have in efforts to improve society and the lives of those that they serve?
I can start. I think that every company has a unique opportunity to make a difference in the lives of those that they serve. And, in our company in particular, we have a 10-year roadmap. We call it Transform Health 2030. We focus on 4 different pillars: healthy people, healthy business, healthy community, healthy planet. And we've built out 10-year long-term goals on where we want to be and how we want to get there. It's centers around stakeholder engagement. So every business has a key set of stakeholders. Those include your colleagues, your clients, your customers, your policymakers, your regulators, all the things that kind of come together. And when you think about making a difference, no one company is going to have the silver bullet to solve a lot of these very pressing public health challenges. So it's organizations like CEP. It's our strategy around collaboration. And I know Latka has probably the same strategy, which is you really have to convene and bring folks together to make a difference. Because when you do that, you're talking about exponential math. 1 + 1 could equal 7, because there's really an opportunity. If we look at an example around disaster relief, that's a perfect, clear example. When something happens in Florida, you see a lot of companies coming together and bringing their subject matter expertise to bear, whether that is UPS bringing products and services in their delivery capacity, us from a healthcare perspective, thinking about those rebuilding efforts. And you see time and time again, private industry coming together and trying to solve issues. I think it continues to be a challenge, as Daryl talks about, that companies have to make money. But from a broader perspective, I think it's it's really table stakes. It's really an opportunity to really make a difference. And those that do it well, do well.
And it's really,
it also can be good for the bottom line, right?
Oh, absolutely. Yeah.
and if you think about it, right, it's a little bit about back to the future, because the original charter of business was to drive progress. And so, after 50 years of shareholder primacy, we're now back in an era of stakeholder capitalism, where we've got to care for, right, the broad needs of a broader group of populations and stakeholders. And so, as Eileen was saying, there's sort of no one size fits all, because we all have different business models, different capabilities. But I think the point is, it's about the ethos and the purpose, as Daryl talked about, right? And why you exist and how you drive this through your business model. Because if you hew closely to your business, your ability to solve societal challenges is going to be greater. And as you said, Morgan, it will enable your bottom line to grow as well.
Yeah, I think both Lotta and Eileen are right on this. I'm an old economist from my school days, and go back to Adam Smith, who talked about the role of the entrepreneur, the businessman, was to meet the unmet needs of society. Now, many times that's done through the product and services that the companies offer, as we have from CVS, Aetna, Prudential, and others in their own way, and competing for those customers. And at the same time, the treasures the company have, the talent that they develop, those time really represent additional skills they can bring to bear. And over time, as we look at CCP, we really want to empower companies to drive their sustainable success through positive social impact. And we think that relationship is very clear. The companies who run their business for long term, take care of their key stakeholders, will perform better over time. You can do better in a quarter by cutting, slashing, ripping out all those things, ignoring your key customer base. But over time, taking care of your communities, your employees, your key stakeholders will deliver superior results. And we've seen that kind of over and over again. So that role as being a force for good, using what companies are specifically good at that they can build and then collaborate on other initiatives, we think is really something that has kind of helped business from the late 90s when CCP started, in the days of Gordon Gekko of greed is good. Business trust was pretty far down. Today, the latest Edelman Trust Barometer results are out. Richard Edelman sits on our board at CCP. Business is now the most trusted institution. Sorry to say media is down a little bit at the bottom there, but other than US News, of course. Government's not much higher here in the States. Nonprofits do all right, but business, because it's adaptable, because it's competent and increasingly ethical, really is kind of that force for good that people trust, especially their own companies.
And I would add, Daryl, the corollary to what you were just saying, right? If there's an opportunity to add value to your company by engaging these issues, we also ignore them at our peril, right? If we really are in it for the long term, we know these issues are going to intersect with our business model, our ability to do business.
Yeah,
exactly. So you can't ignore these things and expect them to get better. So business has to play a role. Particularly, I think every company can, but particularly I think large companies who are in leadership positions.
Mm-hmm.
And no more so did you see that actually in COVID-19? Those companies that were thinking about stakeholders and really preparing and understanding how to solve for that made a huge difference in the lives of those that they serve. And in particular, I think, those on the front line, essential workers, whether they were healthcare workers or retail, these folks came together and really thought about the broader good and really making that connection. Super proud to support those folks as they went forward, because that was sort of the lifeblood of what we all thought. When you don't get to leave your house for a period of time, those essential workers are pretty darn important. And then you think about that, those companies that employ them and really keep them going are those that, they're going to be around for a long time.
And COVID-19 is a really good example of where companies can really make a difference. Can you give some examples of how your businesses are helping with COVID recovery? We're at a pretty precarious moment again. So I'm interested to learn if there are some examples of successful efforts or approaches from the last year and a half.
I mean, I'm happy to jump in, Lotta, if you want to go. But I mean, it for us, we never stopped. The second March 8th was when I literally moved to this spot, and I've been at this spot since then. But there's 299,000 of my colleagues all across the country, and about 180,000 of them were in our stores. So I think those that focus on people first, really the safety and well-being of your colleagues, that was a lesson that all of us know and understand, but it was really borne out in those employers connection with their colleagues, that engagement. We've done surveys over time to make sure that our colleagues felt cared for, that they were respected, that the issues that they were facing, whether it's childcare, emergency needs, time off if they had COVID or a family member had COVID, thinking about that, because your employees are, everybody says this, are your greatest asset. They absolutely are. And so thinking about them first, I think, was a lesson we learned or repeated over and over again.
Yeah, I think the companies that we would look to, right, who were leaders in this were those who, as Eileen said, started with their employees, right? That was where we needed to begin first and foremost, the health and well-being of our colleagues, and then our customers, our clients, right, and how their needs were, their ease of doing business with us in that moment was critical. And so, regardless, I think, of the business you're in, that was a really important and defining moment for many of us. And then equally our communities. And so, right, how we stepped up for the communities to address the equity issue, right? Because we, again, quickly saw the disproportionate impact on Black and brown communities from COVID, and then into the economic crisis, and then the racial crisis that ensued. And so, right, how we were caring for communities in ways that were kind of rebuilding what was lost, but positioning, right, all of us to build back better, as everybody's been saying.
Yeah, and did your funding change over time? We did. We started early on with response funds. Like, we got a ton of folks that were saying, we just need product, we just need cash to literally carry these folks through. Food insecurity went through the roof. When you're thinking about all those components, it wasn't just the unemployment, it has that reverberating effect from a food insecurity perspective. We went and funded a ton of response programs all across the country initially and early, because you wanted to have that money as close as you possibly could get it. And then over time, things have changed, but you're nodding, so that's the same thing that we experienced.
Yeah, and I think one important point in that is that, we're fortunate coming from big institutions, big companies, we've got a lot of levers we can pull, but in moments like that, philanthropy is such a critical resource, because that's what's needed in a crisis, and you need to get the money on the ground as quickly as possible.
Yeah. At CECP, we survey companies, including both Prudential and CVS, on an annual basis to understand how they're investing in society. Corporate philanthropy, if you will. We like to call it investing in society, because it's really about the long-term impact it can have. Last year, and our results are just now in, because you get the data late in the year, up 41% increase, biggest percentage increase we've ever seen from companies investing in society. A good chunk of that last year went obviously to COVID and COVID response, a lot also into social justice movement, since we had many things going on in that area. And we also have understand the report will be published here in a few months, and sort of the best practices that we're seeing, how companies were engaging, but really at 41%. I think if you looked at all that spending of those companies, it would be basically the equivalent of a Fortune 100 company. So lots of money being invested into communities, and that's the philanthropic dollars, the social investment. Also a lot that was going into employees and the customers and supply chains to really make it work. And I think we've seen it. Go ahead.
All right, go ahead.
Yeah, but I think we've seen companies' ability to get information out. Literally hundreds of millions of dollars has been spent in helping to increase awareness of what the issues are through the Ed Council, companies participating in that. The companies that developed the vaccines. This is an amazing piece. There was partnership with some of the governments, et cetera. It's really remarkable. We're delighted to have the CEOs of J&J, of Moderna, and Pfizer on a panel talking about their longer term plans and what they've done with the vaccines back in early June. So companies really doing that. And then it's the delivery. And then, of course, with CVS, thank you for administering my J&J jab in mid-May or mid-March, which was great as well. But just think about how companies did that, as well as dealing with their employee base and their communities. So it really was a time when business stepped up.
Yeah, I think flexibility was the key here, Morgan, because we had to think about not only our customers and our colleagues, but how do we pivot for nonprofits? So I'm sure Latka has the same experience that I did, which is we let people reallocate. We had funded programs and something that they said they can't deliver on. And so, do you want your money back? And the answer was, no, we don't want our money back. Use it for PPE, use it for COVID relief. So it was that ability for companies to be flexible and adaptable to the challenges and the pressures that were happening. Very different in Florida than it was in Seattle, timing of cases and testing. And so being flexible and adaptable, I think, is critically important. And it was, really evidenced, I think, in corporate America, their ability to adapt.
Yeah, I think the flexibility and compassion were critical. Sorry. And I just want, I think the other thing was companies really digging deep and seeing what more they could do. And, for us, it was, we own buildings in Newark where our offices are. We've got retail tenants. Most of them are small business. They're all small businesses, largely Black and brown led, hiring, right, employing Newark residents. And so we've forgiven their rent this entire time because we wanted them to be able to continue to employ their workers so that they could take care of their families. And so there are things like, it's not of huge consequence to us at the end of the day, but it is incredibly meaningful for the people that we're helping.
We also saw a real step up at companies in volunteering in a different way, because that on-site volunteering was going to be very difficult. So a huge transition to virtual volunteering, where people could over Zoom calls really help and support local nonprofits, local organizations, and the like. And that's been sort of a new development that we've really seen, and kind of exciting in terms of just ways that employees, and from our numbers, more than 1 out of 3 employees volunteer with their companies on an annual basis. Some companies are much higher than that. That really had to transform itself so that people could help in a virtual way.
Brand new business of electronic events, lot of fundraising over Zoom and WebEx. And, we also launched a virtual volunteering program that was connected to a lot of the social justice and equity challenges as well in the summer, really helping our folks be advocates and advocate for policies and changes. So if technology wasn't with us, God bless the technology companies, I don't know where we would be. I never thought I would be using Zoom to the level extent I'm using, or WebEx, and I've become so facile, or not, in terms of how to use the technology, because it's been the lifeblood of all of us. What would we do?
Yeah, we've seen that with CEOs. The idea of doing a Zoom call with CEOs before COVID, BC, if you will, just right. No way. CEOs got to be there in the place. And now we're doing them on a regular basis with CEOs. We're getting incredible engagement as we went through the COVID social justice. What CEOs were sharing virtually in terms of what they were going through, the vulnerabilities they had, was really amazing, and where we could help each kind of solve in a way that really works for them. There was no game plan. There was no playbook as we went through a lot of these issues, but companies adapted. I mean, that's why they're trusted so well.
We've already addressed a lot of the stuff that I wanted to talk about. And I certainly want to get back to vaccine and health equity and the public-private partnership and a lot of things like that. But first, I think there might be some attendees that are sitting here thinking, why should I do this? And how do I assess whether what we're doing and what we're spending money on is actually making a difference? So I wonder if you could talk about how you measure impact and the return on investment when you make these these investments.
So I can start. We are in early days of a new measurement framework. And first of all, it is right. I think we've been talking about the case to be made for why companies should do this work. And I think it is sometimes hard to make the case in your institution about supporting things that may not pay off for a period of time. But as Daryl said, if we're really in it for the long term, right, beyond the quarterly sort of reporting and construct, then it should make sense to you that, okay, we should approach these societal challenges in the same way, especially given how complicated, right, they are. We're fortunate that we're an insurance company, we're founded as an insurance company, so we are nothing if not in the business of making and keeping long-dated promises. And so by definition, we've got very patient capital that we can invest in these endeavors. But, in terms of measuring them, that, as we know, is a very complicated endeavor. And so measuring societal impact and the attribution, contribution, all of that, you can quickly go down a rabbit hole. But we're trying to create a bespoke framework because we've got different resources. So, grants and corporate contributions and impact investing, tools that speak specifically to those resources, how we're investing and how we're managing them for impact, which is a whole other great thing. That's an active act. And then also how we are creating shared value. So how do we measure, right, the societal and business value that can sometimes be tangible, sometimes intangible quite often. And so how do you bring a level of clarity and precision around the opportunity that going after these societal issues presents, And then how do you work with your business colleagues to build back, right? Build an initiative then that is targeted at that opportunity set with a clear sense of the business value and the societal value that you can create, and then measure and learn along the way. So we've been doing measurement, but more again in verticals, and we're now building towards this bigger, longer term framework.
Long ago, the days were when you were counting noses. That's where we started from, and where we are today is a lot of what was just covered, which is thinking about it holistically, understanding that no company is thinking about writing a check or making an investment without a clear sense of where their business is, what their stakeholders understand and expect, where there's value. And so there's, small, medium, and long-term kind of conversations and small, medium, and large investments. I'll use the greatest example, the largest one, which was our tobacco decision, thinking about how would we measure that return, and for that one, that was a big number, but we did it with the focus that it was a business decision, because we thought and understood very carefully, talking to our clients and our customers, that we needed to align our perspectives around health, and tobacco was contradictory to that. Knowing that if we got that barrier out of the way, how would it affect our customers wanting to partner with us, wanting to move the ball down the field with us, and that proved true. Unfortunately, we're still the only national pharmacy that has exited tobacco, but the idea of that really opened a lot of doors for us in terms of having conversations with employers and health plans and others to really say, we care about health so much that we remove this product, and we've seen it. And there's a variety of different measures, whether that's reputation. We look at morning consult and kind of view those things as much as we use the stock price and our ability to drive sales. So there's a number of buckets to look at from measurement, but it's not a simple process by any means. I wish it was. And if someone could figure it out, they'd make a boatload of money.
Eileen,
sorry. The CCP does help work with companies, because we do get to tally what companies are investing in society. That's one part. What are you spending? The other part is what the impact is. We really see that in 3 areas. There's a societal impact that can be very hard, because some of the changes we're talking about take generations to look at. And companies, I think, are better at looking at milestones along the way to see if progress is being made. But when you're looking at, is early childhood education, what impact does that have when somebody's 40? That's a long time horizon, even for the longest thinking companies, perhaps with the exception of insurance companies on those.
Yeah, but if you even look at industries like health, though, Daryl, you're looking at data sets that are like 4 years old.
Yeah. Right. So I think one is the societal impact. The second is the impact on the organization. And it's very clear that people who volunteer with their companies tend to be promoted faster, be more engaged employees, less likely to turn over, because they're more bought into what the enterprise is. And then for companies who are purely thinking about the financial side of pieces, over time, companies that invest for the long haul and invest in their communities, pretty clear work, Raj Sisodia at Babson, Bob Eccles at Harvard, they outperform companies that are, don't care about those other stakeholders. So, but it does take some time, but that's really what we're in this thing for, is really kind of long-term sustainable business solutions.
Eileen, I think some of the tobacco decision, it could be really interesting, and how you went about that could be really interesting for a lot of our readers. It's obviously a scary decision, a scary choice to be the only national pharmacy that doesn't sell tobacco in their stores. Could you tell us a little bit more about that decision and what lessons you took from that experience that have perhaps informed any other community health programs?
I would say the biggest learning that I took away from it was collaboration is the key. Tobacco was not a decision that was made in a vacuum. It was a business decision, as I talked about, thinking about it from a stakeholder perspective. But when you announce something like that, you have to make sure that it gains traction. It was not a PR strategy. This was a business decision. And so as a result, the vast majority of the work that was done in preparation for and continued after was building all of those stakeholder partners. So whether that's American Cancer and Campaign for Tobacco-Free Kids and the public health perspective, or even talking to the tobacco companies themselves and our own colleagues to make sure that when people saw it, they really got a sense of what we were trying to do. This wasn't just a PR stunt. This was literally a change in how we did business. And again, collaboration was critical to the success of it. When we announced it, we did it with a chorus of people who said, wow, that's incredible. And I would say not scary, but courageous. You know, our executive team and our board of directors to make that decision was so inspiring to me. And I think it has caused us to make similar type of, you know, if you use that as a Mount Everest, several other Mount McKinleys in our company. Chemicals of concern, human rights, a lot of the components of what we've been able to build are off the idea that, you know, companies need to think about it, you know, begins and ends with materiality assessment. But if you think about what's important to you and what's important to stakeholders and make those decisions, it becomes a lot less scary and more consistent with what your purpose is. You know, Latka said exactly that. It's we are the tip of the spear. You know, we want to bring heart to every moment of your health. That's our purpose. And when we think about how we show up in a community, we're not just helping a community, we're part of the community, how we think about it. So when we think about tobacco, knowing, of course, that made an impact, we should think about the smokers that were going to be impacted just as much as the non-smokers, thinking about the organizations that were going to be impacted just as much as the new organizations we were going to partner with. So really stakeholder engagement for me and collaboration were keys to that.
And a great example of companies just stepping up on really bold decisions, CVS on tobacco. Also another part of CVS, Aetna, where they took up the wages of the lowest paid employees. And it was something that, you know, the market said you pay this, and they said, we need to be at a better rate. It's going to improve, reduce turnover. It's going to get people more engaged. Going to help. It was tied to healthier outcomes for individual employees as well. But really bold steps that a number of other companies have really followed up on. These essentially frontline workers, right, who had no choice to in what they could do. This is before COVID, where they could really kind of step up to really help the employee base as well.
Daryl, I'm thinking back to your experiences before CECP with Kraft, Krispy Kreme, Campbell's, and so on. I wonder if you could talk a bit about what's changed. And are there things that you now know because of your experience at CECP that you wish you had known as when you were a president or a CEO, and or things that you think are vital for all leaders today?
Remember, I sold a lot of healthy products, Krispy Kreme donuts, Oreo cookies, all those other things. So this is my
in moderation, Daryl. Everything's in moderation.
In moderation.
And
Oreos do go with milk of any type, oat milk, whatever you like. You know, in a way, it's really been a great experience, and I really enjoyed the work that I did then. Those jobs had their challenges and difficulty. I think today's jobs are even more complex, but also more valuable, I think, because we're really looking at companies to play a lead, not just make money, take your money, go home, but what positive impact can you make on the world, on your employee base, on your communities? And I think that's really broadened the role of executives like Lata and Eileen and CEOs in that broader perspective. And I think it's really one of the reasons that business trust, we talked about that earlier, late 90s, business was at the bottom of the league tables. People did not trust business. They were, it was, Gordon Gekko, greed is good. Today, businesses are looked at for solutions. They're the people who really are bringing answers. They're being adaptable, being flexible, not getting into the political stuff as a general rule, but looking for solutions to build a better society. So I think the job is much richer. I'm pleased that I was able to do some of that in some of our businesses before, it was, other people thought it was a good idea. I can remember being told to shut down programs because we were doing a program called Labels for Education, was a Campbell Soup. Shut that down. It's, we're not getting a great return on that. And we actually learned it was incredibly powerful efforts. Similarly at Krispy Kreme, where we did a program called Fundraising, which was kind of like Girl Scout cookies, but you didn't have to wait for 6 months to get them. You get your donuts on Tuesday and have them sell them at a football game down south on Friday. That kept our company going. So I kind of learned that on the way up. Now, as I get the big picture, you can just see how valuable those purpose-driven decisions are in terms of really connecting with key stakeholders.
And continuing on that, what are some of the common challenges or questions you get from CECP members?
Yeah, I think this is new. Most of our CEOs, and they're fortunate to have people like Lata and Eileen and other leaders in the space, but most of them did not get their jobs because they're necessarily socially responsible. They just didn't get measured on that as they went through their career, nor did they get a lot of classes on that. So for some, they just got it naturally and they understood it, but it also wasn't things that people were recruited for in those roles. I think today, understanding what those, we call them the hurdles on the purpose journey are, understanding them, and even if you don't have the answers because you may not, finding members of your team who can do that can make a difference. And we've seen probably 5 areas on this purpose journey at the top of the list. One is sustainable business. we call it ESG, other names by it. But what does that mean? Because it's going to take a longer term time horizon than the quarter to quarter management. Diversity, equity, and inclusion. And I think both of you all have that in your titles, right? Lotta and Eileen, a new area, but it's probably the biggest opportunity we have as a society today. How do we get more people engaged in our economy and can really have a positive role, not as well as being the right thing for people to do. But for many of our CEOs, that was new stuff. That wasn't what they really understood. So really surrounding them with people who can really advance that are key. Community engagement, we've talked a lot about, big area. Also employee engagement. And what's that next look like with millennials and Gen Z? It may be very different than people who were, baby boomers or Gen Xers are. What does that look like? And also, how do you tell your story? The world's tough out there, right? We've got social media, it's 24/7 news cycle. You can say something and get, there's boycotts and boycotts, all those going on. So understanding how do you navigate those hurdles on the way to purpose, we think are areas that we're hearing a lot of, and areas that we've established now centers of excellence at CCP, we'll be announcing shortly, to really help companies in the journey. Not that we know the answers, but we know that some combination of companies out there have sort of figured this out and have wrestled it through. And where we don't, we'll bring them together and collaborate to see if we can get some of those answers.
Now, when we talk about health, the things we think about are obvious: the tobacco decision, smoking rates, things like that. But we, with Healthiest Communities and in a lot of other ways, and all of us here on the panel, look at social determinants of health. So it goes beyond just the true metrics of health to jobs, the economy, housing, nutrition and food insecurity, financial stability and financial health. So Latha, I know that Prudential has done a lot of work in Newark as a case study. As a case study, could you tell us a bit about that work and how some of those things help improve the community health of Newark overall, even when it's not necessarily specific to a health focused thing?
Sure. So we have been engaged deeply in Newark for the last 50 years. I mean, Prudential is founded and remains headquartered in Newark, and we're 46 years old. So a deep and sustained commitment there. And for the last 50 or so years have really been committed to the investments we make there and to doing it in a different way. And the things that we've sort of ring fenced as the most critical elements of our efforts to redevelop the city were several. So, one is around the definition of an anchor institution and broadening that definition to include businesses, because we, like the eds and meds, which were the classic anchor institutions, are also tethered right to the community. And so it was important to bring that diversity of perspective by including businesses and the platforms we bring that Eileen talked about, that I talked about, where we all talked about. So to add to the mix of, things that levers we can pull. The other thing was, we need to invest in both people and place. And so there are capital investments in the physical redevelopment of the city, but you have to simultaneously invest in people. And catalytic philanthropy, again, is the most important tool in that. So things like job training, and we can talk more about that. But we also know that we need to strengthen intermediaries. And so that, we pulled back from a lot of the direct service things we were funding. Others can do that and do it better than we can. But what we can do is fund the intermediaries, the backbone organization. And so, for example, youth development, right? There's an intermediary now that is very strong, very healthy, that is funding these other local intermediaries that are doing youth development services and engaging in leadership development and fundraising and all the things they need. But we're better suited to do that. And then lastly is building out amenities. And so how do we make sure we need density, right, in the city to support the health and the viability of the city? And so we need amenities to support that density. And, we have a Whole Foods and a ShopRite. So, things that can meet the needs of everybody, residents alike and visitors and people that we're trying to attract to the city. So that's another, that ethos of, we're doing this for residents so that they have agency to make a choice. We don't want people to be pushed out. We want people to leave because they're choosing to leave Newark, because that's a better option for their families. But if they want to stay, there's absolutely avenues for them to be healthy and well. And so, that's kind of how we think about Newark holistically. Financial, addressing the financial needs of the community are a big part of that. And I'm sure Eileen would agree that, financial health is an important part of overall health and mental well-being. And I can talk specifically to some examples of how we do that.
Yeah, I would agree. I mean, for us, when we think about community investment, And how do we really affect those basic social determinants? Housing's a good example. It's hard to focus on your health if you don't have a roof over your head. It's hard to focus on your health when you're worried about what food is going to be on the table or what job you're going to have. We have a variety of different communities across the country that have very low high school diploma rates. We actually removed it as a requirement in our front store just recently, Daryl, when we talked about additional wages. We removed the high school equivalency and the GED and high school diploma from our front store because it is a limiting factor when we think about the broadest access to colleagues. So when we think about investments, we think about housing, we think about food, we think of workforce development, we think about biometric screenings. We have a really great program called Project Health, which goes out and gives, since the program's given $114 million in free biometric screenings to underserved communities. And so thinking about those basic screenings to know your numbers and then funding those organizations that can help you on your path, whether it's chronic disease or others, making sure that those folks don't have to worry about those particular things. Now, again, populations and targets of communities are very different. And so if it's a senior population, they're going to get something very different than a migrant population. But thinking about that and managing through those basic SDOHs, I think are the critical component to not only building longevity for that community, which is the ultimate scorecard, but is step-by-step kind of involvement. It allows you to bring other corporate partners into there, it allows you to bring other partners into a coalition. So there becomes this conversation around health.
We have a lot of healthcare and public health leaders in our audience. What advice or insights would you have for them, particularly if they're looking to establish meaningful relationships with businesses and corporations in their own backyards?
Well, I would say do some research. There is a variety of different reports that all big companies do, and I'm sure Letta and I can swap stories about how we put our CSR report together every year. It's long and defined, and it is very transparent around the things that are really important to us. And so when a nonprofit is thinking about how do they partner with an organization like ours, they're going to start with community health because they're going to see it over and over and over again. What are the opportunities for us to connect with this company? What can we bring to them with a mission-based organization to really make that connection? We invest only in places where there's gaps in our commercial business. We want to get to the most underserved populations as possible. For example, on Project Health, we have mobile units now that we want to get to the places where these people are if they're not going to come to us. So thinking about those connections, I think, are critical, and understanding how a company shows up, its purpose, and how it measures its success, I think, is key.
I would agree, and I would start there if I were looking to get to know a business. And I would also encourage you to think about it as a relationship versus a transaction. And so, right, build the relationship. And I wouldn't even necessarily start with funding, even though that's what everybody needs. But there might be a volunteer opportunity, or there might be a board placement opportunity. And you have to understand how the company thinks about it. We all do it differently. But I think it is, again, about having those conversations, building the relationships, which that front end work can lead to a much bigger and better outcome ultimately.
I think
that long-term relationship is key, that trust component.
Right. That in our research is the companies have moved from lots of little grants to fewer big grants that they can really measure, that are really deep, those relationships built into the organization. So as people are looking to those to partner with companies, rather than it's asking for the small grants, it's to do the research that Eileen talked about, really putting together in an engaged way with the company about what you can do, how you can partner, how you can get people involved in the company, whether it's on boards, whether it's volunteering work, leveraging their skill sets, much more strategic relationships rather than simple transactions is said. But that thinking is different. So you might, instead of having 1,000 people providing $100 each, you may find there's a few providing substantially more funding, but a lot more with it. And with that comes measurement, the skill sets that companies have, and hopefully collaborative efforts with other organizations as well.
I found, just as a funny story, I find a lot of innovative nonprofits will quote my CEO from whether it's a news article or the earnings call or any of the opportunities. And, I'm blessed to have a CEO who truly understands what we do and how the impact that we're focused on. And so I find those folks really who have come to it have done the reading quite interesting, and their approach is very direct, and they cite our CEO. So it's It's like, I guess it's a positive check. Not that I'm telling everyone to do that now, but it's those that look at it that come to a good
and it's
outcome.
where you can match what you're doing with what companies are. So not every company is a match for every potential grant recipient. So being kind of really smart about that, we think is key. And I think that's really helped have greater impact because people are measuring, they're being more focused, much more strategic relationships.
And obviously businesses alone can't do all the work to improve community health. It has to be a public-private partnership. We've talked a lot about what you do. What more would you like to see from leaders in government at all levels to help improve community health?
So I can start. I mean, I think, everybody would benefit from more of a two-way ongoing dialogue between government leaders and civil society leaders. And I think that can do several things. It can help strengthen the policy, right, that comes out of government and make it more applicable to on the ground, right, what's actually happening in the constituents that these organizations serve. It can probably help strengthen the organizations by giving them more insight into, right, what's happening and why what comes out might not be exactly what they wanted, but understanding, how it got done, and therefore being better advocates for it, right, and creating greater transparency to people on the ground so that there's visibility into how these policy pronouncements or decisions are actually positive, hopefully positively impacting their lives. And so I think that, again, creates more of a virtuous circle that everybody benefits from.
I've learned a lot over the last couple of years from my government affairs organization. We have both a state and a federal team run by a leader who has really spent an enormous amount of time and energy building those relationships, right? Those talk about long-term relationships, really understanding where's the shared value, where's that zone of opportunity, thinking about how we make sure they understand us as much as we understand them. And so the conversations become a little easier. I find that, for example, our government affairs folks will often say to us, hey, this constituent's going to be or policymaker's going to be in the market. Can we do a tour of a community health center we've just invested in? Or they're really focused on education. Can we bring them to a workforce development program that the company has? And it's through that understanding what they're focused on, what we're focused on, do we understand what the barriers are, right? To your point, about really understanding where's the art of possible, and learning and understanding and not being responsive is not the right word, or proactive, but engaged, right? And thinking about what's critically important. And I can't say enough about our team because they really try and get to, Eileen, you have to get to yes. How do we get to yes in a way that's meaningful for the community, meaningful for us, and how we can really affect change? And so a lot of it is this ongoing dialogue that over time has been really, really helpful to us in terms of understanding what's important.
And I also think that businesses in today's politicized America need to look for those solutions that are not red solutions or blue solutions, but as Dan Schulman, CEO of PayPal, calls them red, white, and blue solutions, right? That are really good for the broader area. And that's a real challenge, for many of the companies to do, walk that tightrope. But how do you really identify a purpose that really incorporates, all of America, or a huge proportion of the country, to really help us to advance some of these real solutions? That is a real new challenge. I mean, that's something that, you pick your sides back in the day when I was a CEO. Today, how to really balance that. If we're going to have really solutions that are going to stick with us. Often those are easier to do locally. State levels become more of a challenge. Certainly at a federal level, those can be kind of difficult these days. But I think that's where business can really play a role, because it's in our best interest to keep this, these states united, and a global world that we can really, advance together. So those are, one of the real challenges, takes the added finesse that CEOs of today must have.
And that's why data is so important, particularly for health or even a broader aspect of corporate America. When you're thinking about a community, those facts are the facts. So thinking about what are the gaps, what are the things that are most important, that's why data comes in such a critical component of what we do from a funding perspective. And I know a lot to say that as well, is that, when you see high school graduation rates at such a low end, you know that's a component that has to get addressed. Doesn't matter who you are in the community, that's critically important. And so thinking about that's why even the context of reading CEC reports, understanding where companies are funding it, that you can watch those trends and thinking about it from a public health perspective and from an economic perspective, companies are being responsive to their markets.
So before we get to a couple of questions from the audience, I want to ask one more question. We talked a lot about solutions just now. Mental health has emerged as a major challenge and something that will likely be with society for many years to come in the wake of COVID-19. And I wonder what businesses can do here. Eileen, maybe you can start with this one because I know CVS has done quite a bit of work in the mental health space.
Yeah, very early on in the pandemic, our CEO cited mental health being as that second wave, after the pandemic, of really understanding what that was doing. Starting with frontline workers, we spent a number of a large amount of time talking to organizations that were supporting our frontline workers, thinking about basic things like PPE made them nervous and uncomfortable if they didn't have it, and managing through those stories and those support network. Those folks were really taking it day in and day out, and then supporting populations as it became very clear that this wasn't a couple of weeks, this wasn't even a couple of months. So finding organizations that could help identify. So for example, we have a program called Here For You, which is a program for young people. They're trapped at home, having safe conversations, working with organizations like Give an Hour that can help those folks that are navigating and really wanting to not only volunteer their time if they want to support, but also having a sympathetic place and safe space to talk about it. So mental health is really, really very important. No more so now as we're thinking about going back to work, right? Or hopefully, knock on wood, going back to work at some point, thinking about what those transitions. And so I think mental health is a critical component. It's almost been a wake up call for folks to the idea that is such an essential part of how we all operate, and taking the stigma away from it. And it's just the normal thing. Think about your mental health is like brushing your teeth and tying your shoes. You got to think about yourself in terms of how you want to take care of yourself. That self-care was something that I heard over and over again from leaders. Self-care was critical during the pandemic, and no more so now as we think about what those next steps potentially could be.
Yeah,
I would add, go ahead, Daryl.
Go ahead, Lana.
Well, just again, thinking about financial stress as a contributor to mental health issues. And, we started with our employees to really understand. So we cared for mental health broadly, of course, but really understanding how people are situated financially, meaning what their needs are with respect to benefits or with respect to other things that we're offering, whether they're one-time programs or ongoing, so that we can meet people where they were and not make assumptions about our own employee base to start. And then similarly in communities doing the same thing.
I also sit on that National Organization on Disabilities, and the mental health areas we've all seen has really surged. What we're seeing is is just being able to talk about these issues, which we didn't always talk about. Now that we're in Zoom call, and there's different challenges for the frontline workers that Eileen mentioned relative to people who get to sit down and do Zoom calls all day. Both have their challenges because our cheese got moved, as the old book used to say, right? This got moved. Our lives were just upended in this area. So we need to be able to have those discussions. I think it's also been important for leaders to really be able to show their own vulnerabilities, what they're working through, and hopefully no one will be screaming as they run into this room today as we go through. And we've got to sort of get to know people in new ways. But how do we now kind of continue that dialogue, helping provide support throughout that? And we're seeing more and more companies really looking to that, and that this is not something to be hidden, but something we can help to address, and together we can help to solve. And then the solutions I think we're seeing from companies about the ways they're engaging with people, giving them a chance, giving them some time off, we're seeing, or time to just share, just really important areas, because we're all of a sudden communicating literally in a way that humankind's been around here for a long, long time. We've never done it this way before. Right. So as our primary way of communicating with all those. So how do we really help people go through that journey? So this support on the journey and navigating through that is just so critical. And because the trust people have in companies as an institution, particularly theirs, companies have trust is good. With that comes expectations of what companies can do to do more to really help to help their employees, but also their communities and their customers along that journey.
That segues really nicely into a question from the audience. So as COVID wanes, hopefully soon, they say, do you see company engagement in communities decreasing? And how can a community and its non-business leaders keep companies involved? I mean, Daryl, you said investment was up 41% last year. Will it continue? And how can some of these community leaders make sure it does?
Yeah, we'll ask the experts, so they'll know where they are. Certainly, this past year has been an extraordinary increase in terms of how people have been engaged. And as COVID, though, I think, is moving on, and hopefully it will, but there's still time to go on this one, as we all know, and something else may be coming in. I think the other area where we've seen tremendous interest from companies and across society has been on social justice. This is a huge issue. This is, in many ways, one of the biggest business opportunities or challenges that companies face. And we are seeing companies really institute a lot of opportunities and initiatives around social justice into the core enterprise. So a lot of that is going to be in the societal investment efforts, but also how they're working with employees, how they're engaging folks today. If you're a baby boomer, 13% of the people you grew up with were of color. 13%. If you are a millennial or Gen Z or Z, 44% of the people in your cohort are of color. And if you're under that, the number's over half. So that's an enormous change that folks have gone through. We obviously see some pushbacks by certain parts of the economy, but companies are really recognize that's where the future is. So as companies share their long-term plans through our platform, if they don't have a strategy and a plan around that, they're missing out on half the population, which is not going to lead to successful big businesses. So I think those areas, I think it's going to, COVID is an issue. COVID is up and down. Social justice is an issue that's been with us for centuries, and it's one that we need to address.
I would, concur with all of that. And I think, I hope people stay the course. It's needed now more than ever. And it's going to take a long time to kind of rebuild from the devastation. But Daryl's absolutely right. I think the good thing is that there's some tailwinds, I guess, for those of us who want the investments to continue, in that the expectations of stakeholders are also higher than ever. And so, there is definitely an expectation of our current talent, future talent, and others that we will stay the course.
Yeah, I would agree as well. I think that, organizations that want to continue to build those relationships are going to have to think about that in terms of extending the opportunities. Companies have viewed, and ourselves included, as nonprofit relationships and committee opportunities as low risk development opportunities for some of our emerging leaders, and thinking about those opportunities to really bring that next generation to come through. And thinking about problems differently. That diversity of thought is critical when we think about building out the profile of a nonprofit in an organization, bringing a lot of folks together that are commercially focused, that are not mission based solely, and thinking about those brains differently. The other thing I would say is that, as it relates to all things social justice and equity, listening. Really having a conversation and understanding people's points of view, I think was critical for us, and thinking about what's the art of possible for a relationship with a nonprofit, having them understand and listen, and vice versa, is critical. Knowing that, of course, maybe over time, as you build that trust, if a walk or a run or fundraising event becomes a grant, or becomes a board membership, or becomes something else. So I don't really see it going away. I actually see it increasing, because we've got a lot of folks who want to come outside of themselves, right? They've been too focused on their own lives, and thinking about coming outside of yourself. When we think about what the original question was on mental health, this is a good opportunity to get some psychic satisfaction.
I think if there's one good thing that came out of the last year and a half, it's really shined a light on some of these things. It's shined a light on what businesses are doing to help with the COVID crisis, what businesses are doing to help with mental health, helping both their employees and the communities at large. So I think that's a bright spot from the last year and a half, if you ask me. I think we are out of time. I want to thank you all for joining us, and thank you to the panelists for coming. I thoroughly enjoyed this conversation, and I hope you did as well. Thank you so much for joining us.
Thank you
very much for the opportunity.
Eileen, great pleasure to be with you.
Nice to see you guys.
See y'all.